So let's start out by asking, what is hepatitis C? So we need to look closer at the liver to understand this disease and what it does. So many of you know that the liver makes chemicals that your body needs every day. It removes waste and harmful products from what you eat and your bloodstream. It protects you against infection, builds and makes proteins and sugars that your body needs. It stores vitamins, fats, and other substances in your body. And finally, it releases these substances, chemicals, nutrients, as your body needs it. So the bottom line is, you can't live without it. Now let's think about hepatitis C. As you can see in this slide, it's a virus. In fact, it's a very common viral infection, the most common blood-borne infection in the United States. And unfortunately, you don't know you have it. Most people have few or no symptoms when they are infected. Acutely, it causes maybe short-term illness that you could confuse for anything. And then in about 60 to 85% of people, it transitions into a chronic infection. So the virus stays in your body, and that's chronic HCV, which is potentially a deadly disease. It can lead to fibrosis, cirrhosis, and also, most frighteningly, liver cancer. So let's think about what that is in the liver. Here's a picture of the liver. Now, most of you know from eating liver or whatever, it's a beautiful, shiny, kind of pearly, brownish color. Then when it gets fibrosed, it starts getting a little irregular. Then cirrhosis, you can see in the center there, is nodular and scarring, and the blood flow starts being disrupted. And then finally, with cancer, the cells become totally abnormal. So this is a pretty scary scenario. Now, it takes a long time for this to happen. As you can see, about 30 years from the time you get infected until you get to cirrhosis. And then you've got a couple of paths after cirrhosis. One is end-stage liver disease. That's bad news. And the other is cancer, hepatocellular carcinoma, HCC. That's also bad news. So why do we worry about liver failure? It is a significant cause of illness and mortality. And when you get sick, you get very sick and you need a lot of healthcare services. About half of all liver transplants in the United States are from damage caused by hepatitis C. And if you think about it, each one costs much more than $100,000 per. So that even though not a lot of people in the United States with hepatitis C eventually need transplant, even a few are very costly for the system and for these individuals. So this shows you what the main causes of hepatocellular carcinoma, which is the most common kind of liver cancer in the United States. And you can see in purple and in the blue that about half of all of these are caused by hepatitis C. There's also about 15% that are caused by hepatitis B and another 33% that are caused by neither of the above. And I'm going to talk about this a little bit later. So, as I mentioned, HCC is the most common form of liver cancer. It is obviously increased by having chronic HCV infection. You can treat it with surgery, medications, or a liver transplant, but it has a poor prognosis no matter what you do. So our goal is really to prevent the development. Now, one of the other worrisome things out there in terms of factors that might cause HCC is obesity. And we know now increasingly that obesity damages the liver too. So that if you put together obesity and hepatitis C, you have a really toxic combination for the liver. So hepatitis C kills, and it's actually killing more and more people. From 1999 to 2007, it's increased about 50%. In 2013, about 20,000 people died from HCV. Most of them were aged 45 to 64, and the median age of death was 57, which is about 20 years younger than people live on average here in this country. And one of the things you need to know is that the 20,000 number is actually way low. There are probably a lot of other HCV-related deaths that we don't code as being related to hepatitis C. It not only hurts the liver, it can cause kidney damage, so it's underlying a lot of disease in this country.